Good morning and welcome to this U.S. Food and Drug Administration media briefing on front-of-package proposed rule. The press release on today's announcement has been posted to the FDA's website. I'm Enrico Dinges with the FDA's Office of Media Affairs, and in a moment I will turn it over to Dr. Rebecca Buckner, the Associate Deputy Director for Human Food Policy, and Dr. Rubin McKinnon, Acting Director for the Nutrition Center of Excellence in the FDA's Human Foods Program. After the remarks, we will move to the question and answer portion of the call. Reporters on the phone will be in listen-only mode until we open the call up for questions. And as a reminder, this audio call is being recorded and live-streamed on FDA's YouTube channel. When asking a question, please state your name and media affiliation. And also, please ensure your questions pertain only to today's announcement and limit yourself to one question and one follow-up so we can get to as many questions as possible. With that, I will now turn the call over to Dr. Rebecca Buckner, Associate Deputy Director for Human Food Policy in the FDA's Human Foods Program.
Great. Thank you so much, and welcome to today's call. I'm happy to be here today to discuss the FDA's proposed rule to require a front-of-package, or FOP, nutrition label for most packaged foods. If finalized, the proposal would give consumers readily visible information about a food's saturated fat, sodium, and added sugars content, three nutrients directly linked with chronic diseases when consumed in excess. The proposed FOP nutrition label, also referred to as the Nutrition Info Box, provides information on saturated fat, sodium, and added sugars content in a simple format, showing whether the food has low, medium, or high levels of these nutrients. It complements the FDA's iconic nutrition facts label. Chronic diseases, including heart disease, cancer, and diabetes, are the leading cause of disability and death in the U.S. With 60% of Americans having at least one chronic disease, such diseases are also the leading drivers of the nation's $4.5 trillion in annual health care costs. A large body of research indicates that a major contributor to this problem is excess consumption of saturated fat, sodium, and added sugars. And yet the vast majority of Americans exceed current recommended limits for all these nutrients. There is also a proliferation of foods in the food supply that are commonly considered ultra-processed, which often contain high levels of saturated fat, sodium, and added sugars. The proposed Nutrition Info Box is focused on providing accessible information to help consumers quickly and easily identify how foods can be part of a healthy diet. As our Deputy Commissioner for Human Foods noted in our earlier communication, we believe that food should be a vehicle for wellness, not a contributor of chronic disease. The Nutrition Info Box, the recently updated Healthy claim, the FDA's work to develop a healthy symbol, and the draft Phase 2 voluntary sodium reduction targets are key aspects of a government-wide approach to improving nutrition and reducing chronic disease in the U.S. These efforts can help consumers more easily identify foods recommended by the Dietary Guidelines for Americans and may assist them in reducing their consumption of certain nutrients that can be found in foods that are commonly considered ultra-processed. In addition to our goal of providing information to consumers and in response to front-of-package nutrition labeling requirements, it is also possible that manufacturers may reformulate products to be lower in saturated fat, sodium, and added sugars, making them healthier. I'd now like to turn it over to Dr. Rubin McKinnon, Acting Director for the Nutrition Center of Excellence, to share more about the proposed rule and the research we conducted to inform our proposal.
Thank you, Dr. Buckner. I am pleased to be with you all today to discuss this signature nutrition initiative. If finalized, the rule that we propose today would require food manufacturers to add a nutrition info box to the front of the most packaged food products 3 years after the final rule's effective date for businesses with 10 million or more in annual food sales, and 4 years after the final rule's effective date for businesses with less than 10 million in annual food sales. The proposed nutrition info box is backed by a substantial body of research, including a scientific literature review, consumer focus groups, and a peer-reviewed experimental study conducted by FDA. In 2023, the FDA conducted an experimental study of nearly 10,000 U.S. adults to further explore consumer responses to different types of front-of-package food labels. Study sample mirrored the U.S. population on age, sex, education, and race ethnicity to ensure those most at risk for diet-related diseases were adequately represented. And the purpose of the experimental study was to identify which front-of-pack schemes enabled participants to make quicker and more accurate assessments of the healthfulness of a product based on the levels of saturated fat, sodium, and added sugars displayed. We tested 3 different types or categories of front-of-package schemes that reflect major types of schemes used in other countries around the world. First, Guideline Daily Amount, or GDA, scheme, which provides numeric information about certain nutrients, currently used voluntarily by some members of the food industry. Second, nutrition info schemes that show low, medium, and high for the different nutrients, providing additional context and interpretation for these nutrients. And within this category, we tested different design elements like magnifying glass, black and white version, color, as well as with or without the percent daily value. And our third major type or category was the high-end schemes, which are those that would only appear if a nutrient fell into the high description. We found that the nutrition info schemes performed best overall in helping consumers identify healthier food options based on the levels of nutrients displayed, saturated fat, sodium, and added sugars. Participants provided more correct answers regarding the healthfulness of the product than the other schemes tested, and also spent significantly less time evaluating the nutrient profile of a product. And of the 5 variations of the nutrition info scheme, the black and white version with the percent daily value performed best in most cases. For example, participants considered the black and white version with percent daily value as the most useful, most trustworthy, and the easiest to use. And all of the findings were consistent across demographic groups. We encourage you to review the peer-reviewed experimental study report that's linked to the FDA's front-of-package nutrition labeling webpage for more details on the study purpose, the design, procedures, and results. The FDA is committed to continuing its comprehensive science-based activities to help create a healthier food supply, empower consumers with information, and support lifelong healthy eating patterns. With that, I'd now like to turn it back to the moderator to begin the questions and answer portion of the call.
Well, thank you, Drs. Buckner and McKinnon. At this time, we will begin the question and answer portion of the briefing. As a reminder, this call is being recorded. When asking a question, please state your name and media affiliation. And also, please, again, ensure your questions pertain to today's announcement and limit yourself to 1 question and 1 follow-up so we can get to as many questions as possible. Operator, we'll now take the first question.
Thank you. Our first question comes from Misha Osman from Inside Health Policy.
Hi there. Thanks for taking my question. This is Misha from Inside Health Policy. I'm curious to know if there is a reason why FDA focused on labels such as high in added sugars, like instead of adopting ultra-processed food labels like some other countries. Some experts say that adopting ultra-processed label is a better way to fight chronic diseases. So I'm curious why FDA made this particular choice.
I could take that question. Thank you so much. So the science on these particular nutrients of concern is very clear, and the dietary guidelines for Americans recommend limiting saturated fat, sodium, and added sugars. We also know that a large majority of Americans exceed the recommended limits for saturated fat, sodium, and added sugars. So there's a direct link between an increased risk of consumption of these nutrients. So the science is very clear. And we know that that dietary patterns that are characterized in part by lower levels of these nutrients result in a lower risk of dying from any cause, including from cancer. So we're looking to provide access to this information at a glance so people can quickly and easily identify and compare foods and have access to interpretation and additional information about this interpretive information on these particular nutrients. Thank you.
And I would just add to that these nutrients are often, as I noted, found in ultra-processed foods. And so, we are, in focusing on these nutrients, we are addressing ultra-processed foods.
Yeah, there's a high degree of overlap between foods that are high in added sugar, sodium, and saturated fat. So there's a great deal of complementarity there as well.
The operator will take the next question, please.
Our next question comes from Rachel Rubin from Washington Post.
Hi. On that question, on the previous question, did the FDA, it's my impression, did not conduct focus groups on that kind of stop sign-shaped warning label found in other countries. Did the FDA believe that it did not have the legal authority to put out that kind of a warning label? Or if not, why did the FDA not include that in its focus group study?
Yeah, so you can find access to all of the labels that we tested, both in the experimental study and the focus groups they're available online and available from our front of package labeling website. But so we focused our research using insights from the focus group testing, the review of the scientific literature, review of other schemes from other countries, and also to align with our legal authority. So again, our goal here is identifying a scheme that best helps consumers quickly and easily identify foods that can be part of healthy dietary patterns.
So did the FDA believe the stop sign labels had a higher uphill legal climb?
I think we were, as noted, our goal with this is to provide consumers with information, and we did test a high-end label, and the nutrition info box tested better than that.
Yeah. Across the board.
The operator will take the next question, please.
Our next question comes from Joyce Frieden from MedPage Today.
Yes, thanks for taking my question. Could I first just remind the speakers to identify themselves by name, since their voices are a little bit similar. I wondered, I think it was in the press release, or might have been in the consumer advisory, it said that the talked about manufacturers being able to voluntarily add information to the front of their packaging, like calorie information. I wondered if you'd spoken to manufacturers and whether they seemed disposed to doing that.
So this is Rubin, McKinnon, and so we heard a lot. We did an extensive engagement in the lead up to the proposed rule. We had a public meeting, we had listening sessions, we met with numerous groups. We did hear interest in including calories. We did not include calories in the proposal as a mandatory requirement, and because we're looking to provide additional factual information for consumers. However, in the proposed rule, you'll see that we have provided examples of how a manufacturer could include that information in addition to the required nutrition info box. So there's a couple of different examples of how they might do that voluntarily.
The operator will take the next question, please.
Our next question comes from Alexander Tin from CBS.
Hi, thanks for taking my question. I'm wondering if you could also address how you decided where to set the bar between medium and high. And then a follow-up on something that I think Dr. Buckner said earlier. Can you explain to us why you think it's possible manufacturers will reformulate their products? Just help us connect the dots and why you think the labels will result in that. Thanks.
I could take the first question. This is Rubin, McKinnon, and so the high, medium, and low altogether based on the long-standing usage of 20% of the percent daily value as being high, 5% of the daily value or less being low, and medium being in between. So in answer to your question, it's really based on long-standing usage, and we go into more detail in the proposed rule on that. On the second question,
I believe this is Rebecca. It was why would manufacturers reformulate, I believe. And I think, as noted, we assume that there may be manufacturers who would want to reformulate to maybe move from the high category into the medium category or the medium category into the low category for some of these nutrients, if that is something that they are able to do with their products.
Yeah. But that's not our intent, but they may have they may choose to reformulate in order to do that.
Operator, we'll take the next question, please.
Our next question comes from Leah DeGrou from CQ Roll Call.
Hi, thank you for holding this call. I wanted to ask a little bit about the timing here. Curious if you think, this is something that could be finalized under the next administration, and if you've had any conversations about kind of what the future of this rule could be.
This is Rubin. I can speak to the timing. I mean, diet-related disease is an urgent issue. Chronic diseases are at crisis levels in the U.S. Cardiovascular disease, cancer, diabetes, these are the leading causes of death and disability in the U.S. And as Rebecca mentioned, leading drivers of the $4.5 trillion in annual healthcare costs. 60% of Americans have at least one chronic disease, and 40% have two or more. We know that poor diet, characterized in part by diets that are high in added sugar, sodium, and saturated fat, increase your risk for diet-related disease, and front-of-package labeling is one avenue to be able to provide consumers with additional information about these nutrients in food. So developing and issuing this proposed rule has been a high priority for the agency for a long time, and so that's why we're so delighted to be able to issue this proposed rule today.
Okay, we're going to now go to another round of questions. Operator, if we have another question, please.
As a reminder, if you'd like to ask a question, please press star 1.
Okay, seeing no questions, again, we thank you all for joining and participating in this media call today. This concludes today's media briefing. A reminder that a replay will be available on the FDA's YouTube page. And if you have follow-up questions, please don't hesitate to contact the FDA press office at fdaoma@fda.hhs.gov. And again, thank you for joining us. Goodbye.